Hey, folks, welcome to our webcast. This is Dr. Mahajan from Mahajan Medical Center. Very excited. We have our favorite guest, our friend and ARNP, Jordan. She is our in house expert on exercise, dancing, yoga. So we are very blessed to have her to guide our seniors. For those of you folks who don't know me, my name is Dr. Ranjan Mahajan. I'm a board certified internist. I practice internal medicine in Largo, and we have a team of great nurse practitioners. Jordan is one of them. She has done few other exercise videos for seniors, and you can look at them on our YouTube channel or Facebook Live channel. Uh, so uh, we'll get started in a minute, and I'll get Jordan on the show. Before that, let me give you a brief introduction about Mahajan Medical Center. Stay tuned. At Mahajan Medical Center, we care to listen to our patients. Proudly serving the needs of Tampa Bay in primary care for 25 years and counting. All right, we're back. Let's bring Jordan on our webcast today. Hello, Jordan.
Hi.
So you're live. Are you excited?
Yes, and nervous.
I know. You always do such a good job. Do you want to start out by introducing yourself?
Sure.
How long you've been with us and your background a little bit, how you got into medicine.
Yeah. So I've been with Dr. Mahajan for almost 5 years, and I went to SPC to get my RN license, and then went to USF where I got my master's and became a nurse practitioner. And as a nurse. I worked in skilled nursing facilities, and now I'm able to still do that because I round and follow the patients that are in assisted living and the rehab.
So we got you right out of the master's program, right?
Yes.
And you turned out good under our tutorship. All right. So we got a very exciting program. You want to talk about what you got for us today?
Yes, today we're going to show you guys some yoga for seniors, but also for anybody. When I was doing these different moves, it actually felt really good. So I'm excited to share some with you guys.
That's fantastic. So our topic today is not just yoga for seniors, just the exercise for seniors. And I just want to bring up why I think I wanted Jordan to do that, because exercise for anyone has a lot of benefits, but for seniors, your friend Marian Spearman is saying hello, Jordan.
Hello.
Hello, Marian. Thank you for watching our webcast. All right, so we are talking about why we want to exercise, and especially for seniors. I think the key piece is that exercise helps you stay active. If you ask any senior what's their biggest fear, their biggest fear is they will not remain independent, whether it's walking, whether it's daily activities of living like dressing or balance or falling. And exercise like chair yoga has huge benefit for keeping them independent. So for me, as a physician, as a geriatric provider, that's critical to keep my seniors independent, whatever the settings are at home, assisted livings, so that they can have a energetic life. And it sounds counterintuitive that you say, I'm going to do exercise or chair yoga, I'll get tired. But no, you get more endorphins and you get more energy, right?
Yes. Mm-hmm.
And the other important piece is it's not just good for the body, the exercise or chair yoga or any form of exercise for the seniors. The other worry I get from the seniors all the time is is I'm going to become forgetful, or I'm going to get dementia, or I'm going to get Alzheimer's. And there's a lot of good data that if you do exercise in your senior years, you get more circulation to the brain, and it helps you keep your mind strong too. So you get
Mm-hmm.
less chances of getting dementia or Alzheimer's if you do regular exercise. So that's another good reason to, uh, follow what Jordan going to teach you today, the chair yoga. Um, the other piece which patients talk to me about are the fears they have as they get into their older years is falling, and the balance is critical. As we get older, and our nervous system, our musculoskeletal system, our bones, uh, joints, they are kind of tendons, ligaments, they're not as robust anymore. So you got to practice some form of exercise, and the CDC, the Center for Disease Control, recommend at least 30 minutes 5 times a week or 150 minutes a week exercise to uh, get the good benefits of exercise. And you say, gee, man, 30 minutes is too much if you're not exercise kind and you're sedentary right now. So I tell my patients, you can break it into 2 chunks or 3 chunks for that matter. You can do 10 minutes 3 times a day. You can do 15 minutes twice a day, morning and evening. And what Jordan going to teach you is beautiful. I watched the video. She did a great job, and we'll run in a minute. And you will see the benefits of doing that accumulatively. You didn't get here overnight. You got to practice it on everyday basis to reap the benefits. But if you do them regularly, your balance improves and your falls will go down. So that's other fear patients have, because if you think about it, falls are a big uh, risk for seniors to cause hip fractures and deaths even. So the falls, if we can prevent in seniors with regular exercise, will reduce hospitalization, will reduce the need for inpatient rehab. So just investing every day 30 minutes will prevent you ending up in the hospital or rehab. So we got another listener, Charles Gifford, and they're saying swimming is amazing if you have access to pool. So that's a good point. Thank you, Charles, for chiming in and watching a webinar. Yes, chair yoga is just one form of exercise for seniors. Uh, any form of exercise, and swimming is one of my favorite. I agree with you 100% that if you can use the or have access to the pool, and in Florida we're blessed, we have a lot of places with access to pool, YMCA, for example, Largo Rec Center, even some of the gyms have pools too because of the senior population. So, the swimming offer you advantage of gravity issues, especially with seniors with arthritis and joint pain. So that's a good point, Charles, that if they can swim or do water aerobics, uh, that's a fantastic way. The only hindrance is, if you have to go to the pool, number one, and then number two, you have to change, and so there's a lot of inertia and logistics involved with pool. But if you enjoy it, I'm all for doing water aerobics and swimming. What you want to add anything, Jordan, to that?
I know too, doing exercise, it helps your mood a lot. If you're depressed, if you have anxiety, it really, even just for me, when I work out, it makes me feel good. It helps me start my day off right, and it gives me the energy I need for the day. So it's really like a mood booster.
That's
And Yeah. So.
That's a great point. Mental health aspect of the exercise is critical, and the other aspect, if you do, let's say, something like a class, like chair
Mhm.
yoga class or water aerobic class, as Charles is recommending, it gives you a community benefit too. You see your friends, and doing exercise with other folks is much more fun, and then you make a community out of it. And I think that itself helps you prevent dementia. But when you're not just exercising, but you're having fun, and you are interacting with other folks, and that keeps you motivated as well. So if you can do with other folks, with a buddy or in a class, I think you get a social benefit, along with the good point you made about endorphins helping you with mood, anxiety, depression. Also sleep. If you think
Mhm.
about it, if you exercise regularly every day, your REM sleep improved quite a bit. And I think I tell all my patients who are concerned about dementia or concerned about cardiovascular disease or other chronic ailments, the three pieces of lifestyle you need to follow. One is exercise, which we're going to elaborate a little bit more with chair yoga. The next is the food. So if you give good offering to your body or good nutrition, that's critical. And the last piece is sleep. So I think they're all tied together. If you exercise, you get better REM sleep. You eat better, that helps you with recover from the exercise and also improves your mood. So if you do those three things, that's what I call three-legged stool, which will keep you strong. You want to add anything to that, Jordan?
No, I don't think so.
All right. So let's keep moving and talk about other benefits of exercises, why we should do it. I think bone strength is another important piece. As we get older, we get osteopenia and then further osteoporosis. And if you do weight bearing exercise, chair yoga is not weight bearing, but if you walk or even just treadmill or any weight bearing exercise, that will make your bones denser and prevent osteoporotic fractures. So you see people bent over as they get older because there's spontaneous compression fracture in the spine. And if you work on your core, for example, Pilates is another of my favorite. We're not going to cover here today in this program, but uh, the core muscle strengthening is will help you prevent, along with weight bearing exercise and calcium supplementation and nutrition, protein in your diet. Uh, that will help you keep your bones strong and prevent fractures of your hips and your back, from reducing falls also. So that's another key. Balance will improve and bone strength will improve. And the other piece I want to bring up here, and a lot of good data on that, is if you do cardiovascular exercise and even chair yoga on a regular basis, what you're recruiting is your breathing. We forget anytime we do any exercise, we are using a breath. When you use your breath, that helps you uh, control your autonomic nervous system, which is the nervous system which helps your heart and your lungs. So if you do any kind of exercise on regular basis, whether it's chair yoga or cardiovascular exercise or swimming, as Charles pointed out, or Pilates, or for that matter, biking or whatever makes you happy and you can do it, you will see you will have less blood pressure. Your blood pressure improves if you do regular exercise. So that's another beautiful advantage of doing regular exercise. And the other part attached with the blood pressure is uh, heart health. So if you have congestive heart failure, you have coronary disease, you had stents put in, you had a bypass in the past, any of those conditions, COPD, you will see that there will be advantage of exercise on your heart health, your lung health, because you're combining not just exercise, you're also combining breath work with the exercise. And you're going to talk a little bit about combining breathing with your chair yoga too, right, Jordan?
Yes.
Okay, fantastic. Do you want to get started
Yeah.
on the exercise first? All right, let's
hmm
get uh, started on our program. All right, so this talks about. Let's go to the next slide. We talked about that, the joint, the muscle aches. So let's go to chair yoga. So chair yoga, as you can see, it's low risk and safe and reduce joint pain. As we get older, is joint pain is one of the common complaints we see in our practice. And the beauty is no equipment needed. You just need a armless chair. So just as long as the chair is sturdy and strong, you're good for chair yoga. All right, so we talked about these things earlier. We'll just reiterating. You get better balance, your flexibility get better, you get less stress, and Jordan mentioned about mood, and that's critical to help us in this COVID era. We all under a lot of stress, lockdowns, and staying away from loved ones. So the exercise have the beautiful benefit of stress reduction and you know um, and improve mood. And then we talked about enhanced breathing, better sleep, improved circulation, pain management, and muscle gets stronger too. So again, we touched on most of the things earlier, and it's just a repetition just to emphasize why we should do it. Um, now we'll come to the how to do it.
Today I'm going to show you guys some chair yoga. Exercise is one of my favorite things to do, and I'm excited to teach you guys some chair yoga today. Yoga has a ton of benefits, and exercise in general is important to reach a healthy lifestyle. As we get older, it can be harder to exercise due to joint pain, muscle aches, and fatigue, and this can cause us to have a sedentary lifestyle. But with chair yoga, it's safe and effective, and it keeps your body strong without the joint stress. Some other benefits with the chair yoga is better balance and flexibility, stress reduction, and improved mood. It also enhances your breathing, helps you sleep better, improves circulation and pain management, and it also strengthens your muscles. For chair yoga, all you're going to need is a sturdy armless chair, a flat surface, some comfortable clothing that you can move around in, enough room to be able to stretch out, and of course some water. Okay, so to start, we're going to take 5 deep breaths. Inhale in and exhale out. The second exercise is
So, the 5 deep breaths is to good jump start into chair yoga. You want to go over the benefits, Jordan, of the starting with the deep breathing?
it just relaxes your body, gets you ready for the exercise. It's just a good way to start, warm up your breathing, and get ready for the other exercises.
Fantastic. So let's go to the next one.
Called an overhead stretch. You're going to start with your hands by your side and sitting straight up. You're going to bring your hands up over your head, hold them for a few seconds, and then bring them back down to your side. We're going to do this 5 times, and each time you're going to inhale on the way up and exhale on the way down. The third exercise is called.
Hi, Jordan. On the overhead stretch, do you want to go over, just tips a little bit and what's the benefits one more time?
Yeah, so when you're doing this one, you want to make sure you're sitting up straight with your shoulders back, it's going to help with your posture. It's going to strengthen your ab muscles, and also stretches out your deltoid muscles.
So that's a
good
great
one.
point. So, it helps you with deltoids or the show muscles too, right? All right, so let's go to the next piece.
The neck stretch, and we'll start with the right side. You'll take your right hand and stretch your neck towards your shoulder. Make sure you're sitting up straight and breathing throughout this. You're going to hold each side for 30 seconds. The fourth exercise.
All right, so, the next stretch is you want to talk about what's the benefit and what are the salient features.
Yeah, so this one's very good for stress, especially if you have neck pain. It helps stretch out your neck and it feels really good. It also relaxes your whole body.
That's a good point, Jordan. So let's see what else you got for us.
Called a reverse arm hold. You're going to put your right arm behind your back and then grab your hand with your left hand. You should have your shoulders pressed backwards. Hold each side for 30 seconds. Next, we're going to do the chair pigeon.
All right, so I think let's go back one. So the reverse arm hold, do you want to talk about how to do it right?
For this one, you have to make sure you're sitting at the edge of the chair because, of course, the back of the chair is going to be in the way if you don't. You want to make sitting up straight with your shoulders back. It's going to stretch your arms, your spine. It also helps with spinal tension. So if you have any spinal tension, it's going to help relieve that.
That's a good point. Let's see what else you got here for us, Jordan.
You'll want to sit at the edge of your chair and bring your right foot up towards your left knee. Sit up straight, hold that for a few seconds, and then lean forward. Then you're going to want to switch and do the other side. The last exercise.
All right, it's chair pigeon. So what do you want to tell us about it?
This one's a great stretch for your hips, your pelvis area, and also your hamstrings. It's really good for low back pain and hip flexibility.
Yeah, that's another common complaint we get with the seniors is back pain and hip pain. So, that I like this chair pigeon. What's the name of the other name of a pigeon? It's called Skyrack.
Oh, I didn't know
It eats everything and it destroys everything. Every places, but I like the chair pigeon exercise for the back.
Yeah, that's one of my favorite. When I was actually doing the video, I was like, I need to do this one more.
Yeah, no, you do dancing and weightlifting. I think it's important for the hip flexors and your back because you feel the pressure there. All right, let's see. That's the last one. You have one after this, or how many more you have?
Just one more.
One more, okay. Let's get that.
Stretch. You should put your hands on your knees and you're gonna breathe in and bring your back up and then exhale and bring your stomach out. This was just a sample of some different chair yoga.
Right, so that looks like really good stretch for your spine as well. What you think?
Hmm. Yeah, definitely. It's also a good one for your breathing because you're focusing on your breathing with each movement. So it's good for that too.
Fantastic. And let's finish your video. I think you have just the ending now, right?
And this can be for anyone from young to old. Thank you for joining us. And another tip is go on YouTube and look up yoga music. It really helps relax your mind and your body. Thank you. Have a good day.
All right, so you did a great job, Jordan, and appreciate you bringing it up. Let me see if you, I think you have a couple of other slides. Let me bring that up and wrap them up. All right, so let's get the full screen here. So we talked about the cat cow stretch and place your hands on the knees, offer spine flexibility. And by the way, folks, if you missed any of that, I know we went on a fast pace. We're going to post it on our Facebook page at Mahajan Medical Center. And we're going to also post it on our YouTube channel. So you can, what I tell a lot of my seniors, and Jordan has done a couple of other great videos for seniors. In addition, this chair yoga video, is to go to our YouTube channel and then, and there's no fee or anything, just live it, it's, you can just like it and follow it, our Mahajan Medical Center channel. I'll appreciate. But you can just put it on your iPad or phone, smartphone, and then just follow the steps Jordan is doing here. So that should be easy, and then you're doing it correctly. Let's see. Jordan talked about samples. So there's a lot of other exercises, but Jordan handpicked the one she think has the most value for our seniors. And there are a lot of resources, and you can go to Mahajan Medical Center uh, page for that too. That was great workout, Jordan. I'm glad. I know you're busy with your daily schedule, and that you put together these exercises for our seniors, and you did some other programs too. So that's such a great resource to have you on board with us. Let's bring another question we got from our Facebook page. A little bit different, but I think it makes sense to touch on it a little bit. So Charles has a great question. He said, "Do you have any dietary health recommendation for patients on fixed income?" And I like that question because we do get a lot of seniors who are on Social Security only and don't have a whole lot of money. So how we can suggest uh, good dietary recommendation in a tight budget. So I'll start, and you can add a few things to it, Jordan. I think the key is to make sure you make a list when you go shopping. When you're in tight budget, that helps you, know what your priorities are. So with seniors, I think the key priority is that you should have a what I call a rainbow diet, a good mix of healthy foods and vital ingredients. And one of the key ingredient, in my opinion, is fresh produce. A lot of folks will say, "Hey, the fresh produce is expensive," and I disagree with that. I think if you go to a produce store like we have in our neighborhood on Clever Largo Road, the produce like lettuce is not expensive. The produce like cucumbers and tomatoes are not expensive. Produce like carrots and celery is not expensive. So you start your shopping at a produce store, not go to a big grocery store, big box grocery store where the produce is not the best. It kind of looks good there, but then when you bring it home within a day or two, it goes bad. But if you go to a small farmer's market or produce store, I think you get more bang for your buck. It's cheaper, and you're if you are careful in picking, uh, the produce. What I suggested, like carrots, celery, uh, lettuce, um, cauliflower, broccoli. Those are fantastic in any shape and form if you can consume them raw, wash them nicely, Put some olive oil on that, put some light dressing, vinegar dressing, make it at home, the light vinegar dressing. I make my own dressing at home. It's very simple. Just have some lime juice, a little bit of balsamic vinegar, and olive oil, like extra virgin, and put some salt and black pepper. I don't like the creamy dressings. I think there's a lot of processed stuff in that, and it has higher calories. So if you can make the dressing and just shred the lettuce and add the other ingredients we talked about from the fresh produce store, and don't forget the fruits. Get the fruits in season. They are cheaper. For example, we blessed in Florida with strawberries. You don't need to get the raspberries. You can get the strawberries and get the same benefit. So you got to be more smarter in terms of if you're on a tight income and fixed budget, to pick the produce in season. And for example, I go to this produce store I just mentioned on Clever Largo Road, and they have produce which is probably 2 3 days old, and they give it cheaper. So if, as long as it's not rotting and there's no bad taste to it, in a tight budget, I'd rather have that than have TV dinners. So that's the produce part. And then the other part is you can get low fat milk, yogurt, plain yogurt, and add the fruit in season to it and make a smoothie. So if you have a blender, and you can make a smoothie with yogurt, with milk, with soy milk. If you are lactose intolerant, some of the folks are lactose intolerant, the senior as we get older. Uh, so then use the soy milk or milk substitute or almond milk, and they're not as expensive. It's like, for example, $2 you can get half a gallon of soy milk in any big box grocery store. So you got to be smart and have a blender. Blenders are not expensive, and then add some chia seeds to it or flax seeds to it. Um, you don't need a whole lot, couple of spoons, and you can get a bag for $3 4, the chia seeds or flax seeds or both. And now you get a nice meal, with this smoothie. You don't need to get the pre-made smoothie. You can make a smoothie for $2 3 or less at home, and what went in there. And whatever fruit is in the season, throw that in, whether it's strawberry or blueberries. I like berries, they're anti-inflammatory. And then, you can bake. My wife does it all the time. I should not reveal her secrets for her beauty, but I'm going to reveal it anyway. She gets Brussels sprouts and she get broccoli, and she put oil, and she put in the oven for 15 20 minutes, and then and she eat it with hummus. I think that's a fantastic meal if you think about it. You can throw in cauliflower there too, or asparagus. So any of the things which are cheaper, some of them are expensive like asparagus, but broccoli and cauliflowers are not that expensive. So if you make a big lot and then of the baked vegetable, or you can steam it if you don't like baked, but I like baked. You can add oil to it and put some black pepper and a little bit of salt, not too much salt because a lot of older folks are hypertensive. You can add salt substitute, and then have it with hummus. So there you got a nice combination of protein and fiber. And make sure you take it with a big glass of water so you can dissolve the fiber and feel full. So you combine the dairy. We talked about smoothie, we talked about produce, and add some whole grains. Like my favorite is brown rice and quinoa, and you can add that to your lentils or chili. And that's the other thing. You can get the black beans for $1 a pound, $1.25 a pound, and boil it, and add some herbs to it, what I call prebiotics, like ginger or onions or garlic, and add any of the cilantro in the end, or tomatoes, onions in the end, to the black bean soup, and add brown rice, and you got a full meal. And it's not going to break your budget if you get a big bag of black beans and soak it overnight. Not the canned beans. You can get the red kidney beans, pinto beans, lentils, any of those. black eyed peas, and add whole grains with brown rice and quinoa, and you can rotate it. Keep a slow cooker, and it won't break your budget. I can promise you, you can get all this done in $600-700 a month, if you and if you're just doing it for one or two people. So follow that, and I think along with the hydration, water, and exercise, I think you can do it in a budget. Jordan, you want to add something to, if I missed anything on the nutrition aspect? I know you're big nutrition nut yourself.
I think you pretty much covered everything.
At least give us one pointer.
Mm.
I'm just joking with you. Yeah. So I think if you think about the three big categories, which are starches, complex starches, protein, and the micronutrients, and the eggs, I forgot about eggs and fish. That's another thing. Eggs are not that expensive. Um, one or two eggs in any way and shape and form is good source for seniors with bone health and muscle health, and they're easy to make. You can have a boiled egg without any problem, scrambled eggs or omelet. They're not too much cooking effort. um, so I'm a big fan of eggs because of that, because they're cheap, good source of protein. And fish, if you can afford a fish, we live in Florida, we should at least take advantage of that. So fish is good in any way, shape, and form, and then eggs are good. So if you combine all
Oatmeal too.
that, go ahead. I'm sorry.
Oatmeal too is really good.
Oh
You
yeah,
can get it pretty cheap.
great point. And start your day well, folks, and slow cook oatmeal, not instant oatmeal. Don't make a shortcut there, because instant oatmeal is pure sugar. There's not much protein in that, because you need fiber and starches. Anything which cook quickly is not good for you, whether it's a frozen food or TV dinners or canned food. You got to go a little bit extra mile, plan your meals better. What I mean by that is, if you get dry beans and soak them overnight, and then use slow cooker to add herbs to it and water to it, that's much better strategy than canned beans, which are been sitting on the shelf long time, has too much salt and too much things leaching into it from the can. So if you're going to do it right, and they're not expensive. The dry beans, the red kidney beans, the pinto beans, the black eyed peas, chickpeas, any of that, all of that, they're not expensive. You just need to put a little bit of effort in terms of planning and soaking them overnight, and you will have a great chili or bean soup or lentil soup next day. So yeah, you can do it in a budget. So good question, Charles. Yes, so that's important to combine chair yoga or swimming or biking or any of the exercise with good nutrition. I think you'll have good outcomes in terms of uh, good mood, good sleep, good energy, good metab, good bone health, good sleep. And it's not that expensive to do exercise. In fact, it's zero cost. You want to add anything, Jordan? All right, so we're gonna do a breathing exercise with you, Jordan, and we'll close up our show with a breathing exercise. As you know, I'm a big fan of breath work, and I think people don't realize that breathing is a direct connection, one of the very important tool we have to improve our cardiovascular health, our lung health, our mental health. And the reason it's important, and reason the breath, if we understand how to use this tool, it will calm you down. It will improve your lung capacity, especially now we're dealing with upper respiratory viruses. Um, we got another question from Mark Tilly. Let's get it up there. Dr. Mahajan, great job, so informative. Our baby boomer generation now enter a stage of life that is reliant on advancement in medicine. Your directive education approach is so timely. Thank you so much. Thank you, Mark, for appreciating our efforts. It's because of the great guests like Jordan that we are able to pull it off month after month without the guest input. And believe it or not, we don't pay them. you know, so they do it just because we believe that the education is the key. The seniors have the time now after they retire, and if they get a good source or good resource, which is reliable, and there's no political spin or anything, we are selling any shakes or anything. We're not selling anything here other than we want our seniors to be healthy and strong. So coming back to the breath work, so it controls the autonomic nervous system. The way you take a breath. A lot of time we don't think about it. That's why it's called autonomic, because it's automated. The Mother Nature makes a breathing automated. But if you do the breathing automated or on your own, it's shallow. And once you pay attention to it, then you can extend the breath, whether it's inspiration or expiration, and that will have profound effect on your mind and your lungs and your cardiovascular health. There was a big study out recently on the inspiratory muscles. If you practice strengthening your muscles of inspiration, which is breathing in, it can lower your blood pressure in 3 months or 6 months if you do it consistently. That's huge. I'm not talking of any pills here. I'm just talking about breath work or making your inhalation stronger. You can use the incentives parameter for that. And today I'm going to give you 3 exercises, which I'm going to do with Jordan, which is similar to chair yoga and very similar. So I think one of the exercises you did, Jordan, was, isn't it, when you breathe in, when you go up, right?
Mm-hmm.
And then you breathe out when you go down, right? You gave that
Mm-hmm.
order, right? So that's a good exercise. I'll just add the breath part of it. Let me take my stethoscope out. So the breath part in that is when you're going in, breathe through your nose like you're smelling the roses. So, and then when you're coming down, when you bringing it down, breathe out like you're blowing a candle. So again, anyone who has COPD, congestive heart failure, coronary artery disease, hypertension, this simple exercise doing 10 times, and I'll give you 2 more with that, twice a day, 3 times a day. And I'll tell you, once you get comfortable doing that on a regular basis, I'll tell you how to make it even more effective. So again, let's do it one more time, Jordan. So you breathe in through your nose as if you're smelling your roses, and then breathe out through your mouth as if you're blowing a candle. Very simple, and do it 10 times a day, twice a day. So that's number 1. Number 2, same concept, but now you're in front, right? You put your hand in the front and you breathe in through your nose as if you're smelling the roses, and then stretch for a minute, keep it as far as you can go, and then count 1, 2, 3, and then blow the candle. Very simple, same concept as breathing in and then breathing out. When you're breathing in, you're using your nose, and when you're breathing out, using your mouth. So again, inhalation through your nose and exhalation through your mouth with the pursed lips. So now we gave you 2, and I'll give you the third one. Third one is my favorite. What you do is like you're sniffling. You keep your spine straight. All these you can do sitting up. First one you can do stand is better, but if you have poor balance or something, then you can do the first one overhead stretch, breathing in and out, sitting, to what Jordan taught you earlier. Or you can do standing if you can. I think that will give you more benefit if you stand with that. But if you can't, you get dizzy, then sit and do it. The third one I'm going to give you is sniffling. So what you do is sniffle, like you're sniffling. Do it for 10 seconds. It's very hard to do it for 10 seconds. So, try putting a stop clock and do it for 10 seconds. So again, you're sniffling. So sniffle. in and out, quick breath. So as long as you can do, make sure you're not getting lightheaded or dizzy. If you are, then stop. So if you do these three exercises along with what Jordan gave you on the chair exercises, it will help you with specifically if you do these three, it'll help you with your COPD, which is the patient who have damage from smoking or pollution, what we call chronic obstructive pulmonary disease, which is emphysema and bronchitis. It will also help you with interstitial lung disease, which is again a form of disease we're seeing with post-COVID patients. Their lungs are damaged. These breathing exercise will help the inspiratory muscles. The good Lord gives us a lot of reserves, and those are not, come into play unless we force it to come in play. So by doing these exercises, the inhalation, exhalation through your nose and through your pursed lips, you're pushing your inspiratory and expiratory muscles to get more stronger than what they already are. And we don't think about it, we don't exercise them. But if we think about it and exercise them, we can channelize these muscles for chronic conditions, and you don't need the medications. So that's win-win. The last piece I wanted to talk about is that if how to make it more effective. Let's say a month you do it 10 of these three set of threes exercise for the lungs twice a day, and you say, oh boy, it's becoming easy. So then what you can do is very simple: add 5 pounds weight. So when you're going up, go with the weights. So if you go with the weights, you just hold the weight in the front for the same exercise. And, let's say in 3 to 6 months, 5 pounds become too easy, go up to 10 pounds. So there's different ways to make them more, effective as you become used to it. But don't start with the weights first. I won't recommend it. Wait 3 to 6 months till you get comfortable with these exercises. What you think of those, Jordan?
Those are good. I like them.
Oh, we got the approval from our
The sniffling was hard.
What?
The sniffling one was hard. I got to work on that one. Mm-hmm.
There is a variant of the sniffling. Do you want to learn one more, Jordan?
Yeah.
Okay. So the variant of sniffling is a pranayama or breathing exercise in yoga. It's called, quick breathing or breath of fire. So in this, you focus on your upper abdomen. You can put your hand there and take a deep breath in, take a deep breath out. Just make sure your belly muscles are engaged in both breathing in and out. Now take a deep breath and then breathe out. Just focus on breathing out through your belly. So you're not focusing on breathing in, just focusing on forcing the breath out. Excuse me. So this is like sniffling, but it's a different variant because you're not thinking about in and out. In this, you're just thinking about breathing out from your upper belly muscles, right? So let's try it. Take a deep breath and then breathe out. The breathing in happen automatically, right? When you just focusing on breathing out, right? You're throwing the air out through your nose. The body automatically draws the breath in. But it's a beautiful exercise. You do it, for 1 minute. If you can, start with 15 seconds, 10 seconds, build it up to 1 minute, and you can do it at your own pace. I was doing at a fast pace. It's amazing as it clears up your sinuses. It, calms you down, relaxes your mind. And it's called breath of fire because you're just going fast. It's like amazing effect on your overall metab. So if you can add that with sniffling, that's even better. Or if you can't do the sniffling, just focus on the upper belly and just force the breath out. So you're not using this muscles as much in sniffling, using the nasal muscles more. So you're using these muscles when you're sniffling in and out. air, you're forcing the air out through your abdominal muscles. And same effect, but I think sniffling is hard. All right, so that brings us to the end of the program, Jordan. I appreciate your time, and I know you put a lot of work in getting these exercises together. So thank you so much.
You're
And
welcome.
we want to do one more program maybe down the line, and we'll think of something a little bit more challenging this time for the middle-aged folks, the younger folks. We've done few now for the seniors, and we'll do some for the younger population as well. How about that?
That sounds good.
All right. You stay safe. And one more last piece. I know we're getting a lot of questions about booster shots. So let's talk about that. You got your two shots, right? Like the COVID-19 vaccine.
Hmm.
Yes. So which one do you get? Uh,
I got the Pfizer.
Pfizer, right?
Hmm.
Yeah. So that's one I got too. So we're getting a lot of questions about, whether the seniors who are 50 above or 65 above or 70 above, should they get the third shot or the booster shot? Um, and it's a little bit controversial because the CDC came out saying only for immunocompromised folks, and the definition was very narrow for the third shot, which was the patients who are on chemo drugs or rheumatoid arthritis medication infusions, or or the patients who are on transplant drugs. But then the White House came out, I think next day or a couple of days after that announcement, and they said, "Oh, September 20th or 22nd, everyone who has had the second shot 8 months back, like healthcare workers, nursing home, can have the booster shot." So that kind of caused some confusion. I think both ideas are right. The immunity does go down as we get away from the shot. But in terms of the immunocompromised, there's no ifs and buts. They should get it right away. In terms of the folks who are who got the second shot in 8 months back, which is the first shot when it came out, I think December, January, when we got it as healthcare workers. I think there's logic to that, but the FDA has not approved that part yet. The booster shot for the seniors and for the healthcare workers. So I think they are coming up with an announcement from FDA in next few weeks. So there's no rush to go to the vaccine sites right now. Folks who had two jabs, what I read from CDC and the FDA, I think the White House jumped the gun a little bit, but I think they're on the right track. But let's see what the FDA come up with the third shot. I think it's going to happen. FDA typically takes its time and weigh, all the pros and cons. So that's good to deliberate on it. But there's no rush for any seniors right now to go for the third shot if they had the two shots and if they're not immunocompromised. But the more important part is what I wanted to share. For example, right now in the hospitals we go to, the Largo Medical Center and Modern Plan Hospital in Clearwater, there's a big spike of cases. I think on an average in last 1 week, we're seeing anywhere from 140 to 165 cases in Modern Plant. In Largo Med, anywhere from 60 to 70 cases of COVID-19 positive in the hospital. And the sad part is, out of, let's say, today's number at Modern Plant, 147, 148, something around that, only 22 cases were vaccinated. So this pandemic is becoming a pandemic of folks who are unvaccinated, and which is sad because we are fortunate in the United States, as you know, Jordan, that we are very fortunate that we got a very effective vaccine very early in the pandemic, and we have availability and it's free of cost. So there's no reason, and I understand the people hesitancy initially when the vaccine came out. It came out quick off the blocks, and The reason it came out quick off the block is the mRNA uh, vaccine research has been going on for last decade or so. So we were at right place, right time. With the previous COVID strains, we already had the experience of mRNA vaccine research. So then they just used that template, and so that worked out good. And we got a very effective vaccine like Pfizer and Moderna with the mRNA template with 90% plus efficacy against the alpha strain. The delta strain, they're not as effective, but still very effective. So anyone who is still thinking um, that they should get it or not get it, I understand your hesitancy, but it's time to do it because um, it's becoming a pandemic of unvaccinated the way it's panning out. Even if you will say a counterpoint to my point, sorry about that. So I was talking about, 20 cases out of 148, 149 were vaccinated at Mount Plant. They still got the disease. And that's a good point. But out of all the cases we're seeing in the ICU, 2025 cases, none of them are vaccinated. So uh, it's very important to understand the vaccine does help in preventing serious illness, uh, preventing respiratory failure. So folks who are not vaccinated, I think it's a good time to revisit uh, the facts you have in front of you and your thinking and do it. All right, with that, we come to the end of the show, and we appreciate Jordan joining us and providing us with a fantastic video and chair yoga. If you missed it, you can see it over and over again at our Facebook page. Please like us and send us a comment if you want something different, or if you have any questions. We'll like to answer those. And then if you want, you can go to YouTube channel at Mahajan Medical Center, and you can watch Jordan's other videos on exercise for seniors too. Thank you so much for watching. And with that, we come to the end of the show. We'll see you on our next show next month. Do tune in, and we'll make announcements for who the guest is and when it's going to be. Take care and stay safe.